Hello, hi, this is Dr. Sujata Nair from Anatta University. We are a facility that treats addiction to alcohol, substances, and prescription medication. We treat single clients at our luxurious facilities close to nature with an exclusive alternate life therapy program, wherein our therapists, counselors, doctors travel with our client and live with them, being available to them 24 by 7. Now, in our experience of 16 plus years, we have seen that a lot of relapses that happen in the field of addiction have a sexual connotation. And sex and sexuality is a very least understood subject in society and least spoken about subject in society also. With this in view, we decided that today's webinar we should bring in an expert on board, Dr. Colonel Rajiv Sood, who is a postgraduate in urology. He is HOD and head of department and heads the andrology, the urology, robotics, and renal transplantation department of Fortis Hospital, Vasant Vihar, New Delhi. Dr. Sood, since I've just elaborated that there's a lot of anxiety associated with sexual function in addiction, post and pre, so there's a lot of confusion around it. Could you please elaborate on the same?
Good morning, Sujata and everybody else. Thank you for having me on your show. I would like to share with the viewers that we don't live alone. So most of our problems, if we have our partner alongside, it makes life easier. So I hope that most of you are watching this show in tandem with a partner. Talking about anxiety, sadly, the current times are such that there are a lot of factors from financial, from disease-related issues, grief, overall health status that we are going through a lot of anxiety. Addiction, when we resort to an addicting substance to ease that anxiety, it spirals into a lot of other problems, and sexual problems, of course, being one of them. When everything is not going right, since sex is a pleasurable activity, we try to indulge in sex in the hope that it will take away all the other troubles. But again, both these things happen together, and so you cannot address a sexual or a sexuality issue in isolation. It has to be addressed in terms of how the person, his companion, and how society look at the overall problem. So we will try to address sexuality and sexual issues as we go along.